Hello. So the Mini-CEX, or the Mini Clinical Evaluation Exercise, is an assessment designed to explore clinical knowledge, critical thinking, and problem-solving skills. It's quite similar to the case presentation and case-based discussion. However, the primary difference is that it involves a real-time interaction with a collaborator on a clinical scenario. The scenario should be adequately complex to reflect your recognition level and should be an as yet unseen case so that your collaborator can see your critical thinking in real time and how you approach a case in order to offer constructive feedback. There are various ways to undertake this scenario and different people who can be a collaborator. I strongly suggest engaging a general practitioner or other medical doctor in this process, as it is an opportunity to learn from them and have a highly clinical lens put to your work. This would be particularly appropriate for a consultant level practice recognition. This is, of course, quite challenging, so there are additional options. If you are fortunate enough to practice close enough to a fellow aged care on-site pharmacist, you can have them oversee you in person, either by travelling to them or having them come to you. If not, I suggest running through a case virtually. This can be a de-identified case that your collaborator provides you, or with the appropriate consents in place and considering privacy issues, sharing a case from your own practice that you have not yet evaluated may be an option. The practice recognition level will dictate the complexity of the case or situation. A resident level may suit a medication history taking process, provided it is still adequately complex. And a registrar or consultant level should aim for something challenging, such as involving a high level of expertise and nuance, such as recommending deprescribing medicines for a particularly frail person, where there may not be a great deal of evidence to support decision making. The case itself can be flexible, but it does need to demonstrate a high level of clinical reasoning. So it can be a comprehensive medication review. However, this is likely too complex for a person to have oversight over to watch in real time, as this would likely take quite some time to undertake. More appropriate options may be responding to a specific concern or request, such as frequent falls in an individual, or reviewing someone's antipsychotic use in the context of changed behaviours and reviewing ongoing appropriateness. Taking an accurate medication history, as I said, may also be an example, as this involves critical thinking to align various sources with conflicting information. When reflecting, you should focus upon the information gathering processes, the reasoning and decision making, the organisation skills, professionalism in the ethics and the accountability that you've shown, and very importantly, communication skills, whether these are verbal or written. Thank you.